Hello everyone, this is Dr. Yaşar Başa. I am consultant andrologist located in Istanbul. Today I would like to talk about the axial rigidity in penile implant surgery and the rear tip extenders. As you know, we have an andrology clinic based in Istanbul and we are one of the highest volume center for the penile implant surgery prosthetic urology based in Istanbul and Europe. Today I would like to talk about the axial rigidity and the rigidity of penis after penile implant surgery and try to tell you about the perfection in the penile implant surgery. I saw a patient around 6 months ago. He got implant surgery 3 months before that I saw him, and he was complaining about that. Doctor, I am very well with the implant, but I cannot penetrate vagina. When the other doctors consulted me, they told me that this implant works great. I have a problem, but I cannot have sex and I cannot penetrate vagina. When I put my hand on his penis and forced it, I saw that penis is bending too much. And I asked him how many centimeters of rear tip extenders used for you. When we checked his surgical reports and guarantee card, we saw that he used 5 centimeters of rear tip extender and 15 centimeters of corporeal body. Let's talk about details in penile implant surgery. You know that our penis has two parts, two corporeal cavernosa, which are the erectile tissue that gets blood into inside and gets erection. When they stop working, we put two penile implant, two body of prosthesis to obtain erection after severe erectile dysfunction. And when we are trying to understand the physics of the penile implant surgery, there's some important point. You know that there is a term which is called axial rigidity. Rigidity is important for the penile prosthesis. You know that there are two parts of implant body, the inflatable parts and the non-inflatable parts. For all types of implants, there is the mechanism part, and which is around 4 to 5 centimeters depending on the brand of the implant, and the inflatable part of the implant. When we are trying to calculate the size of implant, we do a corporotomy incision, the incision that we open the corpus cavernosum, and then we calculate the proximal and the distal part of the implant. As you know, there are two parts of penile body, the inner part and the outer part, and the level of corporotomy, the level of the incision that we make to open the corpus cavernosum is very important to calculate the right implant into your body, because when we do distal corporotomy, the corporotomy very close to penile body pays our perfection in penile implant surgery, because when we put corporotomy distally, we have to use longer rear tip extenders to preserve the angle of the cables that are coming out of the implant, and so we have to use longer rear tip extender. When we use longer rear tip extenders, we impair the axial rigidity of the penis, and so at the end of the implant surgery you can have a hard body but you cannot penetrate the vagina. This is the main problem. When we calculate it, for example, this is a 20 centimeters of implant, and when we calculate it, the 9 centimeter of the implant is an inflatable part and 11 centimeters are non-inflatable parts. So 55% of the implant is non-inflatable and does not have impact on axial rigidity. For example, this is an implant, this has 24 centimeters of body, 4 centimeters of this part and proximal part, and half centimeters in the distal part is non-inflatable. So around 5 centimeters of this implant is non-inflatable, but 19 centimeters of this implant is the inflatable part of this implant. So around 75 to 90% of this implant is inflatable part of the implant. So non-inflatable ratio is very low for this implant. So the axial rigidity problem is solved by the bodies that has more portion for the inflatable part. If you think of getting penile implant surgery, you have to choose the right clinic, because the first surgery in the implant surgery, penile prosthesis, is very important to have less complication and have more satisfaction rates. When you see these implants, this is a good surgery. For example, when you see from outside, the tips of the implant is located under the glans penis and everything looks very great, but the patient cannot penetrate vagina. We operated this patient, we took out the old implant, we put 3 centimeters more, 24 centimeters of implant, because the implant caused some dilatation in the corpora cavernosa. We put 24 centimeters of implant and we put more proximally infrapubic approach, and after that the patient had, after 6 weeks of surgery, went into sexual intercourse. Now, yes, he told us that, yes, I can penetrate vagina. I have the axial rigidity and I have gained my length back and I am very happy with my implant surgery. If you think of getting implant surgery, please contact us and learn much more about details of perfection in penile implant surgery.